Now coming to the next one. Next question says that we have a 80-year-old patient who is presenting with the painful red eye. Painful red eye. That means it's a acute red eye. Okay. And I have already told you that acute red eye can be due to acute anterior uveitis or it can be acute congestive glaucoma. We will see what is the cause here. And now they are saying that there is a corneal edema, flare here, deep anterior chamber and cataractous lens in the right eye. So the right eye is showing you cataract and this cataract has led to the acute anterior uveitis because we have flare, we have got deep anterior chamber. Deep anterior chamber will not be due to glaucoma. Obviously, it will be due to the uveitis because here we have the miotic pupil. So now, which type of cataract can lead to uveitis, first of all, which can lead to the flare, which can lead to the deep anterior chamber, along with the along with the glaucoma also, because this patient is having the 50 of mercury IOP and in the left eye, it's very high and right eye mein it's okay. So what is the most likely diagnosis? Because guys, we are having the cataract in the right eye and it has led to the flare, it has led to the deep anterior chamber and we have the deep anterior chamber. Therefore, it is not the immature senile cataract because immature senile cataract will lead to the phacomorphic. This will lead to the phacomorphic glaucoma and phacomorphic glaucoma will not have the deep anterior chamber. Then another type of glaucoma that we can have is by the Morgagnian type of the hypermature senile cataract or we can have the sclerotic type. So in both the varieties it will be chalky white in color or it will be the milky white in color. In the Morgagnian, we have the lysis of the cortex proteins. Here we have the lysis of the cortex proteins. Due to the lysis, nucleus will settle at the bottom and these cortex proteins will cause the trabecular blockade. Now once they have got the trabecular blockade, it will cause the open angle glaucoma, secondary open angle glaucoma, and secondary open angle glaucoma means there will be deep anterior chamber. This glaucoma is called as the phacolytic because it is due to the lysis of the cortex proteins. Therefore, this glaucoma is called as phacolytic glaucoma. And what about the uveitis? So, these proteins which are released are actually antigenic proteins because these proteins are antigenic. They contain the sequestered antigens. Therefore, they can induce the uveitis. And that uveitis can actually show you the flare as well as the deep anterior chamber. So when we have open angle glaucoma, we will have normal anterior chamber. When we have angle closure glaucoma, we will have narrow angle of anterior chamber. And when we have got the uveitis, it is a deep anterior chamber. So basically, it is the phacolytic glaucoma, which will also be accompanied with the phacogenic uveitis. This uveitis is called as the phacogenic uveitis, and that is why we are having the flare and the deep anterior chamber. That is the reason that answer to this question is the phacolytic glaucoma. This phacomorphic glaucoma, which is found in the immature senile cataract, cannot be there because here we have the swollen lens. Swollen lens is obstructing the aqueous outflows. Obviously, we cannot have deep anterior chamber. Here we have no deep anterior chamber. Malignant glaucoma. Malignant glaucoma cannot be there because this glaucoma takes place after the intraocular surgery. So there is no history of intraocular surgery. Rather, they are saying that there is a cataractous lens. And Fuchs hydrochromic iridocyclitis may there is no cataract here, and rather here we have difference in the iris color of the both sides. That is why it is called as the heterochromic iridocyclitis. So that is clear cut, not an option. So your answer is A. I hope it's very clear. If there is any doubt, feel free to put it in your comment section so that I can discuss that doubt also. So when you do it in your exam, that doubt is cleared and therefore you can go with the right option, guys. Okay.